How does one identify and treat various types of medical emergencies encountered in the field? Medical emergencies can occur unexpectedly, requiring prompt identification and appropriate treatment to ensure the best possible outcomes for patients. In the field of emergency medical services, EMS, it is crucial for healthcare professionals to be able to recognize and manage a wide range of medical emergencies. This article will discuss the essential steps and considerations in identifying and treating various types of medical emergencies encountered in the field. Identifying and treating various types of medical emergencies in the field. 1. Rapid assessment and primary survey. When encountering a medical emergency, EMS professionals should initiate a rapid assessment and primary survey to identify and address life-threatening conditions. Assess the patient's level of consciousness, airway, breathing, and circulation, ABC. Look for signs of severe bleeding, respiratory distress, altered mental status, or cardiac arrest. Perform a systematic head-to-toe assessment to identify any visible injuries or abnormalities. 2. Cardiac emergencies. Cardiac emergencies, such as heart attacks or cardiac arrests, require immediate intervention. Recognize the signs and symptoms of a heart attack, such as chest pain, shortness of breath, and sweating. Initiate basic life support measures, including cardiopulmonary resuscitation, CPR, and defibrillation if necessary. Administer appropriate cardiac medications, such as aspirin or nitroglycerin, as indicated by protocols. 3. Respiratory emergencies. Respiratory emergencies, including asthma attacks or respiratory distress, require prompt intervention to ensure adequate oxygenation. Assess the patient's respiratory rate, effort, and oxygen saturation levels. Administer supplemental oxygen to improve oxygenation. Administer bronchodilators or other respiratory medications based on the patient's condition and medical history. 4. Allergic reactions and anaphylaxis. Allergic reactions and anaphylaxis can be life-threatening and require immediate treatment. Recognize the signs and symptoms of an allergic reaction, such as hives, swelling, difficulty breathing, or low blood pressure. Administer epinephrine promptly in cases of anaphylaxis, following established protocols. Provide supportive care, such as antihistamines or corticosteroids, as appropriate. 5. Stroke. Timely recognition and intervention are crucial in cases of stroke. Use the FAST acronym, face drooping, arm weakness, speech difficulties, time to call emergency services, to identify potential stroke symptoms. Activate stroke protocols and transport the patient to a stroke center if available. Monitor vital signs and provide supportive care while awaiting definitive medical intervention. 6. Seizures. Seizures can be alarming for both patients and bystanders, requiring proper management. Ensure the patient's safety by removing any objects that may cause harm. Protect the patient's airway and provide supportive care during the seizure episode. Administer anti-epileptic medications if indicated or as directed by medical control. 7. Traumatic injuries. Traumatic injuries, such as fractures, head injuries, or severe bleeding, necessitate immediate attention. Perform a thorough assessment to identify the extent and nature of the injury. Control severe bleeding through direct pressure, elevation, or the use of tourniquets if necessary. Immobilize suspected fractures or spinal injuries to prevent further damage. 8. Diabetic emergencies. Diabetic emergencies, such as hypoglycemia or diabetic ketoacidosis, require appropriate management. Assess blood glucose levels to determine if the patient is experiencing hypoglycemia or hyperglycemia. Administer oral glucose or intravenous dextrose for hypoglycemia. Provide fluid resuscitation and insulin therapy for diabetic ketoacidosis. Conclusion. Identifying and treating various types of medical emergencies in the field requires a systematic approach, rapid assessment, and appropriate interventions. EMS professionals should be knowledgeable about the signs and symptoms of different medical emergencies and follow established protocols for treatment. By providing timely and effective care, EMS professionals play a crucial role in saving lives and improving patient outcomes in emergency situations.